Good morning, St. Lucia, and welcome to the studios of the National Television Network. I am Lucia Joseph, and we're back with you for, it's been a week or two that we've not been on air, and we're here with a very, very special update for you. And no, it has nothing to do with my birthday, though that's a little ways away. But certainly we're here to discuss Breast Cancer Awareness Month. And we'll be looking at the various dimensions of breast cancer, and also to let you know that yesterday, Sunday, the 17th of October, that was Marguerite, the Feast of La Marguerite. I do hope that you enjoyed that feast and that you enjoyed it in whatever way that you did, observing our traditions. In studio with me today is Dr. Owen Gabriel. He's an oncologist. We have Ms. Fadia Campbell, a nutritionist, and we have a psychologist with us, and he is Ignatius Dominic Savio Setut. We know him simply and best as Father Setut. I want to say good morning to all of you, and thank you so much for being here at our studios for this very special discussion. Now, breast cancer, it comes around every year, October. We set that time aside. And anyone looking at breast cancer would find the meaning that it's caused by genetic abnormalities, and that up to 10% of cancers are due to abnormality inherited from parents, and then 85 to 95% of breast cancers are due to genetic abnormalities, as I said. And then it goes on to say that it's as a result of the aging process. Now, what does that really mean for you and me? Where does that put us in the scheme of things? Is everyone predisposed to breast cancer? So we're going to pose that question to our oncologist, Dr. Owen Gabriel. So what exactly is breast cancer, and are we all at risk of it, men and women?
Okay. Yeah, thank you, Lisa. Happy to be here at NTN to discuss this very important subject. I think it's, to answer this question adequately, we should give context to the question of cancer in itself. So cancer is a dreadful, I would say, disfiguring and devastating disease that is important all year round. We do breast cancer in October. We have breast cancer to deal with all around. And we know this is a disease that has over time become more sophisticated, more aggressive. Mm-hmm. Breast cancer in particular has become the leading cancer in the world. So 1 in 4 cancers in the world are breast cancers, and 1 in 6 deaths from cancer are a result of breast cancer. So it's important to know that this formation cells in the lining of the breast tissue, which over time can go from what is called stage 0, where it's an in situ carcinoma, it has not invaded into tissues, eventually after layers of formation and blood vessel formation, and as you rightly pointed out, the play and the balance of genes that control growth and genes that promote growth and those that suppress growth, that imbalance in the genetic makeup will lead to the development of a full-blown tumor that you feel in that breast. And we say it's disfiguring because it's not only physically disfiguring sometimes, but psychologically, emotionally, the impact on the family. We have this impact that this is why we are here today, and this is why this panel is constituted the way it is, because we need to talk of all the facets of cancer, and in particular breast cancer. As a woman, the matriarch, the family, how her role can be modified having been diagnosed with breast cancer. So we are very poised in a way that we want to emphasize the implication for breast cancer on our black women, especially when we see that types of breast cancer that affect us more, and the death and the mortality from breast cancer is increased for black women. So there are issues to be addressed, and there are a number of interventions, both from the level of the individual, your individual responsibility, that of the society, that of the government, and other support agencies, cancer support groups, how they interplay to result in a kind of scenario where we have everybody's best outcomes for everybody in that sense. So I think it's important for us to look at breast cancer in that context of cancer as a problem, a public health problem overall, and especially breast cancer for women and black women in our communities.
And so for us as women, how do we know that or when we should begin to be concerned about our level of awareness, just getting in tune with our bodies for us to know if and when we are supposed to be checking for breast cancer or cell or our predisposition to cancer?
Well, our greatest hope is that October is the month that awareness is heightened, and we can the rest of the year. So at puberty, the breasts become very prominent. It's related with the development of the menstrual cycles of a young lady. Breast development is also in sync with the development of certain types of disorders of the breast as well. Hormonal imbalances can lead to disorders of the breast. So very young women tend to develop lumps in the breast, which could be just cysts, a sac filled with fluid, or a fibroadenoma, which is a rubbery type of lump, similar in some respects to maybe a cancerous lump. But breast cancer is not particularly prevalent in the young age group, that is below age 40. In the world, the average age of breast cancer diagnosis is 62 years. However, in St. Lucia, we will see that age is actually lower than 62, unfortunately. So it's important for us at a very early age to be aware of those changes in the breast and what kinds of changes that are important to see about, or to consult your healthcare provider, albeit a nurse in the community, the family nurse practitioner, any healthcare provider. The idea that a person must understand their breast, and I see both men and women in that respect, because there's the fallacy out there that men don't get breast cancer, and they do. We've had quite a few men in St. Lucia who've had breast cancer. So we need to know our bodies, and not just the breast, although this is what we're speaking about today, but know our bodies and understand the changes that occur and how changes may impact on our health in a very lethal way sometimes.
So to what is visible to us, looking at the breast, what should we be looking for? Some of you may see the appearance of moles. Would that be something to be concerned about? And the lumps that we speak about, isn't maybe something, sometimes people develop things, they tell you, oh, I have a clue there somewhere. What exactly is that lump? Is it above skin, below skin?
Absolutely. So that's a very good question, because, I mean, just in the area of looking and feeling, which is what I tell people to do. You're examining your breast, which is a monthly activity. We suggest a week after your cycle. You want to see, when you look at the size of the breast. Sometimes that breast is larger. Sometimes there's a protruding mass. You look at the shape of the breast. In the shape of the breast, you can see the nipple is in its normal position. Sometimes a pulled-in nipple might indicate that there might be a growth of a lump inside of the breast. You look at the color of the skin, and as you rightly alluded to, changes in the skin texture will let us know that if there's dimpling of the skin, if there is on the skin. These are usually more advanced manifestations of breast cancer. That cancer is not just restricted to the breast tissue. A lump is actually the most important manifestation of breast cancer. But the lump has specific characteristics that would be different to a benign, when I say benign, a non-cancerous lump, because you can have non-cancerous lumps like cysts and fibroadenomas. So that lump is very hard, very irregular. It's sometimes not easily movable, under the skin of the breast. Usually painless. Strangely enough, pain can be a good thing, because pain alerts you that there's something might be wrong with your health. But unfortunately, when breast cancer is in its early stages, there is not any pain. So 90% of persons who come to the doctor for breast pain, what we call mastalgia, do not have a malignant or cancerous condition. They would have what we call a benign condition. But this is important, that it will alert you to see somebody to decipher whether it's one thing or the other. So the lump is the most prominent manifestation of a problem, a breast disorder, and sometimes a cancer. But the skin changes as well. The difference in the areola, which is that area that's darkened, that sits below the nipple of the breast. The nipple might be pulled in or pushed to one side or the other. You may have a discharge from that nipple. So some discharges are transparent, some discharges are colored, rusty, some discharges are bloody. I would say that any discharge, you want to see your healthcare provider just to ensure that this is not cancer related. There also might be lumps in your armpits, lumps at the top of the neck, by the bone. So it's important to examine that entire area of the breast, not just the breast in itself.
And so the examinations, apart from doing it yourself, learning how to do it yourself and properly, what else can a woman turn to in order for her to be able to detect breast cancer?
Yes, I'm happy that you have alluded to what we try to do early diagnosis via either the mammogram or the clinical breast examination. So those two are important aspects of early diagnosis in breast cancer. The mammogram is an X-ray of your breast that we recommend that a woman should have her first mammogram at age 40 to establish a baseline parameters of what the breast looks like, probably without the development of breast cancer. And as time goes on, maybe sometimes in some places annually you have your mammogram. We sometimes recommend every 2 years, depending on your risk factors. If somebody has a family history of breast cancer, you alluded to 10% of breast cancers may occur as hereditary breast cancer. So if there is hereditary breast cancer, you may want to start those mammograms at an earlier age, between 25 and 30 actually, when the breasts are more dense, but you want to do particular tests that will focus and zone in on that breast cancer, possibly breast cancer. So the mammogram is important, and we have it available in St. Lucia, at a number of X-ray and radiology establishments. We have it available in our healthcare facilities, and it simply requires that your doctor will do a clinical examination and then do this mammogram, based on the findings of that clinical breast examination. So the clinical breast examination which is done by your healthcare provider. It's similar to your breast self-examination, but with the particular parameters of medical assessment of that breast and assessing your risk with that. And that should be done at least once a year. You should have that exam done in your annual checkup. Have that clinical breast examination performed by your healthcare provider.
Now, cancer is so complex, and you can have 10 people in a room, all cancer patients. The situation will not be the same, although they may all suffer from the same cancer. So in terms of being able to determine the treatment, and earlier you spoke about the stages of cancer, if you could go this a little deeper for us in terms of the staging, the treatments that you would be using, and perhaps some of the varying facts that would guide you in being able to prescribe that treatment, the grade and so forth of tumors and so forth.
Yeah, absolutely. Thankfully, as we have become more sophisticated in medicine, we have changed generalized treatments to everybody, what is called individualized treatment, especially for breast cancer. So staging involves knowing the size of the tumor, knowing the extent of that tumor, knowing the morphology of that tumor in terms of what kind of breast cancer it is. And I would like to input at this point the prevalence now, especially in black women, of what is called triple negative breast cancer, a very aggressive type of cancer, which is not responsive to hormone therapy, which is a very useful form of intervention, which is just about tablets that you take daily over a few years. Unlike chemotherapy, and radiotherapy, this is just hormone treatment. So triple negative breast cancer is where you cannot administer treatment to these patients. And it's more prevalent in black women. It appears to be more prevalent in younger women, below 40s, and so on. It's prevalent in women who have this gene that you mentioned earlier on called the BRCA gene. So up to 70% of women with the BRCA gene will have triple negative breast cancer, a more aggressive type of cancer. And obviously the survival is much lower in all stages. I mean, for all breast cancers, stage 4 survival is about 20% in over 5 years. Whereas in triple negative breast cancer, that drops down to about 11 or 12%. So it's important to understand that treatment of breast cancer is varied based on stage of disease, type of disease, and the woman herself. Is she a woman who is in her early reproductive years of life? Does she want to have more children in her family? Is it a woman who needs her body for what she's doing in terms of her profession? So we're able to say, well, surgery may not be an option in this case because it's mutilating. We want to administer radiotherapy. We may administer chemicals and hormones and so on to treat that breast cancer. So it all depends on the characteristics of that cancer, specific to that woman, how we treat it accordingly.
Yeah. And a lot of women getting, the news that you have cancer, automatically someone believes cancer equals death. Mm-hmm. In your experience, doctor, is that the case? Is it an automatic death sentence?
Well, absolutely not. Absolutely not. And thankfully, I mean, with progress in medicine, we have been able to increase the survival from breast cancer. In fact, stage 1 breast cancer has a 90% survival over 5 years. And that is to say that we are able to now also increase our screening interventions and our early diagnosis interventions. So once we are able to establish that the breast cancer is at early stages, we are able to achieve cure, if so to speak, in certain respects. I would say only up to stage 4 breast cancer that we do not aim for cure. We attempt to palliate in terms of increasing quality of life of our patients. But in the large majority of cases, we are able to achieve a successful outcome with our patients, never a death sentence. So, and this is why it's important to have the psychological components, the nutrition components in the patient's care. It's not only medication, it's not only surgery, it's not only radiotherapy. These other components are as important as the medical interventions, medical and surgical interventions in treating a patient to ensure that we have the most favorable outcome at the end.
And this is, I'm sure, you've been doing this for so many years, having to deliver news to someone that indeed that they are being afflicted by cancer must be very, very difficult. The psychological impact that it takes on that. And I want to bring in Father Setut in this discussion right now. Father Setut, it's always very difficult to deal with any situation, that's just traumatic in someone's life. How, through your counseling experience, dealing with cancer patients, what is the most common fear your cancer patients are facing?
Over the years in my practice and my professional work with cancer patients, like we touched earlier on, many people see it as a death sentence. And they feel that, well, that's it for me, that I'm not going to survive no matter what treatment that I receive from the healthcare providers. And in my helping to understand that, we have to help them to come to a positive way of thinking. And I would like to talk on this about the four main facets of the spiritual, emotional / psychological, the physical, and the social. Of course, in a cancer patient, the physical aspect is that's what's affected, and then the other three facets are affected as well. So, it's important to help the patient realize that it is not a death sentence, that help is at hand, and that to help them to understand, to get help from the spiritual, the emotional / psychological, and social aspects of their lives, whether it's in the family, in the community, or whatever faith-based group that they belong to, social groups that interact with each other on a regular basis, and to rub shoulders with persons who would uplift them and who are positive about this aspect. Because I think although the disease affects the physical nature of the person, it's important to employ a great deal of positive thinking that would help the person to persevere and to be a fighter of the disease.
And certainly I think so that, you know, cancer patients, they are dealing with a lot of their own issues, beginning to understand how they got to that point. Is it something that they did, beginning to blame themselves? And so you're having to deal with that, and also you have the burden of your family on your shoulders as well, because all of a sudden you feel like now you have jeopardized the stability of the family, because family members are afraid of losing you. There's a financial cost involved in that as well. Someone having to take care of you if you're at some point becoming incapacitated or too ill for you to do things for yourself. So the multiplicity of emotions going on there. So Father, how do you begin to break all this down for a patient, for them to be able to cope?
I think most patients would go through a period of denial before they can come to acceptance. Not me. I am not sick. This diagnosis is not correct. Let me go for a second or third or even a fourth opinion. Not me. You know, there's a great deal of denial. And it's important to help the patient come to acceptance, and on the other hand, to realize that, you know, it's really not a death sentence, that there is help. And to help people understand that they need to be part of the company of and groups who could be positive. Because in our society, there can be some negativity, and that comes out of fear. And if the person is surrounded by persons who are fearful, then that could bring them down even more, you know. And it would be important to be surrounded by positive thinking people. The patient would also go through a period of depression. And that's expected, but it's to, as a mental health care provider, to help them, to pull them out of that dark hole, to pull them out of the negative thinking, the fear of the disease, to pull them out of it, and to help them realize that, you know, with the experience of modern medicine, that there is help. And I'm glad that, you know, people like Dr. Gabriel, that this is his specialty, and that he's well known in the country and in the community, that, you know, he can provide the modern aspects of treating the disease where cancer is concerned. So I think we need to embark on greater positive thinking, that cancer is not a death sentence.
And Doc, for you find that the attitude of the patient will complement the medical treatment?
Yeah, absolutely. I mean, inevitably, a person who starts off from a very optimistic position usually does well in assimilating sometimes very arduous interventions, you know, with treatment, whether it is the surgery, recovering from the surgery, the chemotherapy, the radiotherapy. If you start off with that positive look, then the treatment is better. The impact of the treatment is always more favorable than if it were the opposite of that. So I think that's a very important place to start off.
Before we get into Ms. Fadia Campbell, Father, I want to ask you, so within your practice, what do you recommend for cancer patients in terms of being able to get to that positive place? And I know that faith, our community, a very religious society, spiritual, and so how much of a factor is your faith in this? And what would you recommend for individuals to do on a daily basis, routine-wise, to be able to get that mind in the right spot?
The studies worldwide and the statistics worldwide have proven that persons who are engaged in a faith-based organization, persons who belong to a church, to a group, a faith-based organization, and who are faced with malignant diseases such as breast cancer, that there's greater hope for them, that they themselves have that interior mechanism of faith, of believing in a higher power than themselves, and that when they are surrounded by persons who are like-minded, that is helpful as well. So I would suggest that people have a relationship with a higher power, whatever faith-based organization you belong to, and that persons are surrounded by persons who are like-minded. It's also helpful to be able to engage. There are lots of religious songs or songs that are very soothing and upbeat on YouTube these days that patients can tune in and listen throughout the day. Certainly passages of scripture. I'm sure the patient would have passages of scripture that would help them, that would be uplifting throughout the day. And another thing that would be helpful is to belong to a psychotherapy group, whether the patients can do it on their own accord or whether they can get a facilitator, a mental health care provider who would guide them in that regard, so that they have both the aspects of the spiritual and the psychological for ongoing healing and survival.
Let's bring in Ms. Fadia Campbell, who's a nutritionist, and certainly what we put in our bodies is very, very important. So, Doc, is there a special guide someone should be following? Is there such a thing as nutrition that can reduce the risk of cancer? Is there such a thing in your profession, in the practice, belief?
Absolutely. I mean, this is embedded in what we might call a healthy lifestyle in general. So, I mean, nutrition in isolation of physical exercising, in the isolation of reducing stress, is as important an instrument in fighting cancer as the other parts of aspects of treatment. So it's important to have an overall healthy lifestyle, not just the diet, as it were. It would have to be in association with other aspects like physical exercise and avoiding the consumption of alcohol, avoiding tobacco, smoking, other smoking, just smoking in general, let's say. So all of these come together and work towards the betterment of patients if there's harmony in that respect.
And so nutrition, Ms. Campbell, many people, the sort of reference point for food, it's very, very complex as cancer within itself. Somebody will tell you, well, I had a banana for the day and I'm good on that nutrition scale. So talk to us about nutrition and what exactly is this aspect of eating healthy. I think sometimes we only think of it as having a few fruits and vegetables on the plate section. Even when you go out to eat, you get a very small section on your plate with just a little, toss of lettuce. And talk to us about where we are supposed to be nutrition-wise.
Definitely. Thank you so very much, Lisa. And I just want to start by saying there is, like Dr. Gabriel said, growing body of evidence that lifestyle factors such as your diet, physical activity, overweight, does play a role in terms of reducing the risk of cancer. And as it relates to diet, we speak about balanced diets. And you alluded to the fruits and the vegetables, and that in itself is essentially important as it relates to not only cancer, but you want to advise an individual to eat healthily. And with respect to fruits and vegetables, they do contain what we call phytonutrients that actually help to, these are cancer substances. So you speak about the rich colors in the different fruits and the different vegetables. We call them antioxidants. Actually, they serve as scavengers in terms of the free radicals as a result of oxidative stress on your blood or cells. So you speak about the greens in terms of your dark green leafy vegetables. You speak about the oranges, and you speak about the pinks in terms of the watermelon, the pink grapefruit. All of these would contain cancer fighting agents like the lycopenes and the flavonoids and beta carotene. All of these do contain protective substances for cancer. And in terms of recommendation, the daily recommendations for an individual, we say at least 5 servings of fruits and vegetables daily. But this has changed actually in terms of the daily recommended eating. It is as high as 9 servings, but at least you start somewhere, at least 5 servings. And it might sound a little bit challenging, but what we encourage as nutrition professionals, you can have these as in-between snacks, So a banana, and a medium-sized banana is a serving. You have, let's say, half a cup of chopped vegetables is considered 1 serving. And you can add variety in terms of the diet. It can be blended into a smoothie. It can be added as a main meal to your other meals. It can be added as a side dish. So you try to incorporate even, let's say, half a cup of squeezed fresh fruit is considered a serving of fruit, right? So it's a combination of both the fruit and the vegetables. So you start somewhere in terms of just snacking on a banana, or even the very local foods we have, and we encourage that a lot in terms of looking at what you have around your home. What about the spinach that is, just lacing on your fence, or the green papaya that can be steamed with other vegetables, because this is what we get a lot. They're very expensive, and it is very expensive to live a healthy lifestyle. But just look at the local foods that we have, because they're fresh, they're full of nutrients as compared to, let's say, the imported ones. And those might, be on the shelf for a certain number of weeks. They're not as fresh and nutritious as what we have, let's say, growing in our backyard, for example.
Because you can find some canned fruits, canned vegetables.
Definitely.
And people taking that will believe, well, I have had vegetables, I've had fruit for the day. But is this something that you would recommend, especially for people with cancer, to be eating canned fruits and vegetables?
What I would definitely recommend is the ones, because in a can, it would have gone through a process of whether it is ultra processed, and they would have added additives to keep the shelf life of this vegetable or fruit in the can. So especially for cancer patients, I would definitely recommend the fresh local fruit or vegetable, just to avoid the intake of the other additives as it relates to preserving the shelf life of this particular canned item.
And I know, cancer patients may decide that they just want to go completely, do the right thing by doing the right thing. Is it possible by doing the right thing that you could harm yourself, perhaps by intaking too much of one type of vegetable or one type of fruit, and how do you create that balance? Because, you know, I just tell you that now, you know, everybody, the rage now, the soursop. So everybody's packing on the soursop. People are eating a soursop a day and that sort of thing. Is it possible that you can perhaps have too much of a good thing?
I am happy you asked this question. But as it relates to nutrition, balance is very important. Because no one food will give you all the nutrients that your body provides. So that is why we encourage variety as it relates to your diet. So you have a portion of fruit, vegetables, you need healthy carbohydrates or complex carbohydrate, and that would include food, the root tubers like our ground provisions, sweet potatoes, yam, dasheen, you know, these would be better, and especially with cancer patients, as it relates to the fiber. Fiber is very, very important, and you would get that with your tubers and also your fruits and vegetables. Because what fiber does, it actually binds to the toxins and the poisons and the carcinogens as it relates to cancer, and it is excreted. So you would want carbohydrate as opposed to the refined ones, like let's say the macaroni and the refined rice and flour. You would want more complex, those with more fiber, in order to, you know, get that type of mechanism where it binds to the toxins and it can be excreted. So you speak about your carbohydrate, healthy, complex, your fruits, your vegetables, also legumes, with respect to your peas and beans. And also you want to include healthy fats. And that has, healthy fats would include polyunsaturates or monounsaturates. In terms of avocado is considered a very healthy fat. You look at nuts, they do contain healthy fats as well. Also to the seeds and nuts, so flax seeds and linseed seeds and pumpkin seeds, these are also healthy fats that can be included. You want to minimize the use of trans fatty acids. And based on the research, it is showing there is an association with trans fats and cancer. So you want to reduce that. And trans fatty acids are found in baked goods. So it is good for an individual to read the food labels. So you go to the supermarket and you pick up a product, look at the ingredient and label which says hydrogenated oils or partially hydrogenated oils. You might want to reconsider and put this product back on the shelf because it does contain trans fatty acids, which are very, very unhealthy fats for the body.
And I know for, again, getting to, if someone has been living an unhealthy lifestyle for, you know, for some time, trying to, and this goes not just for cancer patients or people all around, trying to get to that point. So going cold turkey, not something you'd recommend. How are you going to, because going cold turkey means it's almost guaranteed there'll be a disaster somewhere. So what would you recommend for individuals trying to get to that healthy eating of space? And, you know, is it try to reduce one item a day, that sort of thing? Give us a hint there.
Absolutely. So when the patient comes in, we do an assessment because we want to know where you're at, what you're eating, your dietary habits, and all of that. And we assess that. Afterwards, we look at some of the goals, like short-term goals that you can actually achieve. We look at your intake of sugar or salt and all of that. So you can start from that point by reducing your intake of sugar or sugar-sweetened beverages, for example, the sodas and all of that. So you can start at that point and encourage the patient to reduce even their sodium or salt intake or even the fat, especially the bad fats. So you can start from that point and make recommendations for the healthier options, and we can start one at a time. You've not been eating fruits or vegetables, let's start with 1 serving a day, and then that can be increased over time. So we can start at that point by reducing or even eliminating certain does not, facilitate a healthy lifestyle.
All right, I want to give 20 seconds to you, Doc. Our time has quickly come to an end. To give us some parting words.
Well, it's most unfortunate that we have such a brief period to discuss cancer.
We will be back.
I think it would be remiss of all of us and almost irresponsible not to bring up the topic of GMOs in our nutrition. Now, GMOs I think is romanticized. I think we should say genetically modified organisms. It's important to say those words because you started off this whole program by talking about the genetics of cancer, and even sometimes our so-called fresh. We would be recommended by and I know Abacetus dabbles in nutrition as far as growing green in your backyard garden and so on. So it's important for us to have that discussion, and there's so many aspects to it, so many facets,
and we need
to explore in depth. So on. I also wanted to mention that as far as your faith-based organizations and so on, at times we have an exaggeration of that aspect of care, and sometimes people lose track of the essential components of it. We've had situations where in our society there's a lot of superstition sometimes, and you have sometimes these radical types of ideologies that think that only one aspect will serve the purpose of cancer care. So we have to achieve that balance. I think we've all been talking about balance, and this is why this panel is balanced as it is. So there's so much to talk about, but we want to emphasize that health is not a once a year type of thing, and not just October breast cancer. This is all year round. This is all day long, all night long. How we think, what we expose ourselves to, what we read, and what we eat, and how we do, and what we do. So we want to emphasize this is about establishing harmony, in how we live our lives, and what is specific for you, what is best for you in your specific circumstances. It's not one size fits all. There's no one formula to sort this all out. This is all I would like to say at this point.
At this point, thank you so much to Dr. Owell, oncologist and nutritionist Ms. Fandia Campbell, and of course our psychologist Father Ignatius Dominique Savio Setut for this discussion. And as the doc said, time is limited. Don't worry, we will be devoting as many weeks as we need to be able to flesh out all of those various facets of breast cancer as we continue to observe October as Breast Cancer Awareness Week. Stay tuned to the NTN, because coming up next is a live ceremony being held at the Financial Administrative Center. There's a check presentation being done by the Embassy of Taiwan to the government of St. Lucia in support of the Constituency Development Program. I'm Lisa Joseph. See you next time.